Thank you all for being here tonight. My name is Jackie Metcalf, and I'm the founder and executive director of Texas Health and Environment Alliance. How many of you are joining us tonight for your very first time? All right. Great. Thank you. I'm excited. So tonight we're going to go through kind of a high-level overview of the San Jacinto River Waste Pit Superfund site and a few other topics. So I anticipated some new folks being here, so I wanted to make sure that we were all on the same page about the matters at hand. But I want to give a special thank you to all of our guests in the back who joined us tonight to tell us about what their organizations and companies are doing in this area, and we're really appreciative that you came here and provided the outreach that you did, so thank you. One thing I also want to say about that was that we had two large public meetings after the state designated this area a cancer cluster. And we had each guest put a dot or two dots on the signs that they felt were things that matter most to them. And one of those, the number one sign, the thing that mattered most to our guest, was removing toxic waste sites. And the second highest item was providing medical screenings for early detection. So after we saw those responses, that's when we started reaching out to different entities that do things like early cancer screenings. And Houston Methodist Neal Cancer Center provides specific services at the legacy clinics, and there's actually one in Baytown. And so I encourage you to please look into that and see what types of services are offered. So as for us at THEA, we work to protect public health and the environment from the harmful effects of toxic waste. We are a 501c3 nonprofit. We are not the government, we're not a law firm, we're not a water filtration company. And we work in communities that have been impacted by historical toxic waste sites. And many of you know that I grew up in Highlands, and really the work that we do grew out of my family's experience here just trying to live the American dream. So through that process, we have found that you can create change, all but slow. You can if you combine a few basic principles using strategic science, regulatory expertise, and grassroots community outreach. And you can really get things moving within a very slow government process. One of the things that we do, and aside to the regulatory process that is Superfund, is we work to help our communities that have concerns about what appear to be elevated rates of cancer in their community. So in 2015, we performed a study, or we worked with Texas Department of State Health Services on a study they did around this entire area here. So just to give you an idea, the San Jacinto River Waste Pit Superfund site, which we'll talk a lot about tonight, is here. We're over here in Highlands right now. And so this area is a 257 square mile area. We asked the state to perform an updated assessment, and in February, that was in February of 2024. In February of this year, we received the report and their findings. And that is publicly available online, but we also have a fact sheet at the sign-in table that we produced based on that study. They looked at 29 different types of cancer, 22 in people of all ages, and 7 cancer types in children. Now, rather than breaking the report and the data down into these smaller zones, which are census tracts, they only gave us the information for this entire massive area. Very different than the 2015 report. But that essentially was the state health department designating a 257 square mile area a cancer cluster for leukemia, lymphoma, lung and bronchus, and cervical cancers. So we have been working ever since that was released to try to get more information from the state. Because what do you do with that? How do you bring services to the communities when there's over 30 different elected officials, many different towns? How do you look at what might be the common theme across these communities without being able to look at smaller zones? We've gotten some pushback from the state, and our position is pretty firm. The study did not involve any community engagement. It's not a requirement by the state agency, but epidemiologists tell me it is best practices. Even though THEA and community members asked for the study, it is best practices for the state to come to town and say, hey, this is what we're doing, and we'll be back when we have the results. And that was absent. I talked with them often, some of my team members talked with them often, but I don't live here anymore. Y'all do, but y'all weren't involved. Y'all weren't engaged by the agency, and neither were your elected officials. The data not being broken out per census tract is a very critical element that's missing from this study. And then they just ended the study. Despite these findings, they didn't say what they would do next, which is another unusual thing. Typically in these studies, they have a next steps section. Section 8 of the report should be next steps. That wasn't there. We need to know, you found this, now what is next? What is the role that you're going to play in this process moving forward? So we're going to continue to push for information, and we're certainly consulting with epidemiologists, toxicologists, and other experts to make sure that everything that we're advocating for and working off of is truly sound information. I did send an email to Department of State Health Services in May asking for an update because we had made very clear and specific requests to the agency for more information. And I followed up in May and said, do you all have a response to our March letter with the requests? And they said, and this is a quote, at this time, we do not have any additional information as it relates to your request. They do not feel that they owe us anything more. I couldn't disagree with that more, really. They have the data. They have all of this information. They're just withholding it from the community and from the public. And that's a problem. We firmly believe that data of the community should live with the community. If there's any community member, but I'll say a mom, if there's a mom who's concerned and wants to know if multiple children in her elementary school daughter's classroom with retinoblastoma, if that's rare, or if it's higher than normal here, she should be able to have access to that type of information. Our state shouldn't withhold that. We'll come back to that push here a little bit later. So THEA's program, the San Jacinto River Coalition, is a group of concerned community members fighting for the cleanup of the San Jacinto River Waste Pit Superfund site. So getting into that number one concern, and one of the main things that we work on at THEA, the removal of toxic waste sites. Anticipating us having some folks here for the first time tonight, I wanted to go through a bit of different information than I usually do. A bit more background on the regulatory process, and a bit of a high-level overview of the Superfund site and the process. So this right here, many of you all know as the Superfund snake. And it is a regulatory process under the federal government. It is a long and arduous process, and it is a response. There are processes that are more proactive, whereas Superfund and the law that enacted it, it's a response. And so it is prompted by the discovery of hazardous material that presents an imminent threat to public health and or the environment. Also, an important thing for you to know in this process is that if there is a polluter found to be responsible, they fund and commission just about everything in the process. And it is under EPA oversight. But I'll tell you, I've been doing this for nearly 15 years now. They are spread thin. The EPA remedial project managers are spread thin. They have many sites that they work on. And while I think there are a lot of them who have great intentions and are good people, they're not always reading all the things that they should be. They're not always flipping every page that they should be. And that's something we do at THEA. We sweat all of the details because nobody else is, and it needs to be done. It's critical that it's done. But a lot of times in this process, the polluter presents the agency with the information. And you can imagine the conflicts of interest that arise in that. So here today, going through this Superfund snake, we have made it down here to the remedial design for the northern waste pit. And the remedial action, the next phase, has already been completed for the southern site, the site just south of I-10. So here's the northern site, and here's the southern site. And this is Highlands over here, and it's intersected by I-10. So in 2008, the waste pits were listed as a federal national priority for cleanup. And the contaminants of concern are dioxin, furans, PCBs, and heavy metals. The contaminants were found dispersed throughout our environment. It's in our seafood, it's been found in the river water, in the river sediment, in groundwater wells, and in our seafood. This is a real photo of the waste pits during the creation of the southern site in 1965. And you can see here an open, unlined pit with paper mill pulp being pumped into that pit. The site was abandoned in the late 1960s, around 1968, because they were full to capacity. Over time, storms had a great ability to carry this contamination throughout our ecosystem, in addition to the river being tidally influenced every single day. So this was a flood risk assessment, and right here, this little red dot represents the northern pit. And this, what you're seeing here, the variation in blue, was a simulation at Texas A&M that looked at storms and where they would carry the water, going from a tropical storm to a Category 5, which this area has not seen, thank God, and where potentially the contaminants could be carried under those storm scenarios when the river breached its banks. And so you can see there is much further ability down south for the river to flow once it breaches its banks. The EPA estimated that if the waste were to remain in the river, it would remain toxic for upwards of 750 more years. Removing this waste from the river is something that we can do not only to improve this area for our lifetime, but also many more generations to come. So because this site presented such an imminent threat to our communities and our environment, in 2011, the EPA required the responsible parties to do something about it immediately. And that temporary solution, while they figured out the long-term solution, was to build a cap. So here also you'll see these are the two parties being held responsible by the EPA. So this is the northern waste pit. This is I-10 looking south there on the southwest shipyard. So this yellow dashed line is showing you really the extent of that northern pit. On an average tide, about 60% of that dioxin pit is actually under the surface of the water. And so this is in 2011 when that was being constructed. And I actually brought, this is one of the layers that the cap is made up of, and this is the other type of material that the cap is made up of. It's very much like a garden felt material. Y'all are welcome to come up and look at this after the meeting. This actually came off of the pit. That's why it's in plastic bags and why we don't touch it. So, permeable, breathable material. Then different sizes of crushed concrete is on top of that. So the concept of containment was truly a predetermined concept created by the responsible parties. We know that because Waste Management internal emails tell us that. When the cap was being constructed, prior to any of the deep studies that look at the extent of the contamination and what is feasible, based on engineering, all of the sciences, what could actually be done about this? Before any of that took place, their emails said, we want to push containment as the final remedy. We want to create a global consensus for containment. Their words, not mine. So it wasn't based on what was capable. And so for years, there's been this battle over containment. And the cap has undergone repairs, some years numerous times, but nearly every single year since it was constructed in 2011. But containment simply isn't going to work in this setting. It doesn't fit the EPA's policies or their practices. The type of environment right where this site is too dynamic. Therefore, EPA actually has policies that say it is unfit. This photo is from Hurricane Harvey. And again, I-10 is here, so we're looking south. And Harvey disrupted this site horribly. Not only did it peel back part of this cap, on this side, on the river channel, it was eroded so severely that the head of the agency, the head of the EPA, came here from DC at that time, just to tell us how badly this site was damaged. I was the only non-government person in that meeting, but he had a last-minute meeting where he called all of the local governments into a room to tell them, face-to-face, how severely it was damaged. It's not going to work. It hasn't worked. And so in 2017, after Hurricane Harvey, that administrator signed into Federal Record of Decision to fully remove the waste. Fully remove it at that northern site down to a level safe for a child to recreate in the river. At the southern site, remediate it down to a level safe for an industrial worker or a vocational worker. So there was a big difference in those two remedies. In April of 2018, the EPA and the responsible parties entered into an agreement to do the design, the actual engineering and construction plans, and all of the intense studies to figure out how exactly they were going to get it out of there. The EPA had ordered that they isolate the site, take the water out, and remove the waste in phases. In January of 2024, after many EPA authorized delays and multiple attempts by the companies to submit designs that still included capping part of the site, the EPA issued a notice of takeover, or I want to get it right, a notice for seriously deficient design. And so that was in January of 2024. So also during that time, the EPA began onboarding a new contractor. They wanted to be ready. They wanted to be ready to take it over if the responsible parties did not do what the EPA was asking. Well, Also during that time, the EPA began meeting with project managers from comparable sites across the country. There are sites where this has been done successfully. It can be done. It is not some mysterious engineering thing that's never been done. It's been done and it can be done. But the EPA has to see that it's done. So in May, we received an email from the EPA that the responsible parties had yet again submitted another design, their third shot at designing a cleanup plan. So now what? It's the third chance. Maybe third time's a charm? EPA is reviewing the third design package. They're comparing it to comments that they submitted on the second design package. And they're looking to see if, yet again, the responsible parties have done everything that they have asked. We've read the reports. Most of my staff have technical college degrees, and we pour through all this stuff and consult with retired EPA people. You know, we really want to make sure we're understanding everything. And we submitted the most comprehensive and extensive comments on the last design package. Because we were still finding things. When we would ask the EPA about them, they wouldn't know. And we were like, well, didn't you read this? Yeah, it's, about 100,000 pages. But you should be reading all of this. This is not something to be taken lightly. So the EPA did a really good job at listening to our comments, listening to Harris County Pollution Control's comments, to the state agency's comments, and relaying that to the responsible parties. And when we received their comments, our team at THEA was actually pleasantly surprised at how well we felt the EPA was replicating the concerns, many of which a lot of you in the room discussed with us and brought to our attention. So now the EPA is looking at this third chance and seeing, does it satisfy what they have asked them to do this time around? And the EPA is preparing to host a community meeting here, late summer, early fall. We don't have a date yet, but I'm waiting. We should hopefully have a date sometime soon. Please be sure you're on, that we have your up-to-date details so that we can call you and email you and let you know when they schedule that meeting. We'll let you know as soon as we do.
Jack,
one thing, yes?
Is that the cap right there in front?
Yeah.
Can I hold it up and show everybody real quick?
Yeah, you must have missed that.
Okay. You did it already?
Yeah.
Okay. I'm going to pass it around if anybody wants to have it.
Yeah, right.
So you
Thank
can
you, Mr.
imagine
Bobo. He doesn't want to be anywhere close to it.
Easily come up in a hurricane or a storm.
Okay, so some of you may have received phone calls about the 5-year review for the Southern Waste Pit. There's a contractor, Greg, do you recall, is it Skio? I'm drawing a blank. Skio? No? The lady who was trying to get a hold of you for an interview? I think it's Skio, but there's a contractor working for EPA who is conducting community interviews on the 5-year review of this Southern impoundment. So the 5-year review is something that is required at a Superfund site if it's cleaned up but waste is left on site. And that review is prompted by a certain place in the cleanup process. So the review will come out in 2027. But as part of that, they're doing community interviews, they're going to be doing sampling and analysis and seeing, is it stable, what's the condition. So I encourage you, if you do hear from someone who says they're working for the EPA, you can call me if you want to fact check it. You know, make sure it's not some. No, Genetic Coates is the. She's the community. Oh, okay. She's the community liaison for EPA. But you know, I encourage you to participate in the interviews. If you are contacted, I really do, because it's important that they are hearing from the community. And there's a diverse set of interests and concerns in the community. So it's a unique and very rare opportunity to have this type of interview process. Before I move on, I just want to show you the image I put here is the double cofferdam wall isolating that northern pit. And everywhere you see that's within the boundary here that has a shade of green is waste material that will be removed down to varying depths. The deepest area is over here. It goes to nearly 30 feet. But I just want to know, who's tired? Who's tired of it? I'm tired. I mean, I've got toddlers, but like, that's not why that's another tired. But you know, I'm going to be 40 next year. And I've been doing this since I was in college. So let's just talk about the design process. 2018. Like, that's what I'm tired about, right? Like, I'm tired of standing up here and talking to you time after time about the design. Get it done. Get it done. It's 2018. Record of decision. This is waste management stock. Skyrocketing. And then going to now, to 2024 and 2025. Meanwhile, we have no final plan on how they're going to get this site out of the river. It's not for a lack of capabilities. I think we have actually more engineers in Houston per capita than anywhere else in the US. So, we just have to lean on people power. That's really, we don't have that kind of money, right? We don't have the millions of dollars it would take to sue them. Like, we have people power. We've done it before. We got the proposed cleanup strengthened into the record of decision that the EPA signed. And we have to talk to our neighbors. We have to let people know that this site is at a standstill, pretty much. And that we have to be calling our representatives. We have to be calling the EPA and letting them know, we care about this. We want it done. Because if they're not hearing from us, they don't have as much incentive. And many of you, I hope, are registered voters. You are their stakeholders. You are their constituents. And that matters. So, a couple of things that I wanted to note here. Harris County's Commissioner Court, that's Commissioner Tom Ramsey, whose district is north of I-10 over here. And Commissioner Ramsey and actually the entire court passed a resolution urging the EPA, actually I want to double check that. Yeah, calling on the EPA to remove the northern waste pit immediately. So we have Harris County's support, their full support. Our staff met with Congresswoman Garcia fairly recently, and her response was, you know, she's a little surprised, along the lines of she's a little surprised that it's still there. You know, she remembers back when she was it a commissioner? Yes. A commissioner? And working on this issue. And now she's in U.S. Congress. And so our team sent 300 letters to the state and to the federal level recently. And they're community letters. They're letters from many of you and others, asking them, one, for the data in the health study, and then 2, to clean this site up. And sometimes we send manila folders, or manila envelopes, and we'll do like 50 letters in envelopes, something like that. But I said, you know what, nope. We're gonna stuff 300 individual letters, and that's what we're gonna keep doing, because they need to know. And I'm sorry to whoever works in the mailroom, but you know, maybe if he gets really irritated, he can help tell someone about it. So, we have to keep using our voices. Okay, before I get to questions, we have 2 QR codes here that can take you to our different places on our website. One will take you to our newsletter, and one will take you to our health survey. As we continue to push for more information, we still need to be hearing from you. So please let us know if there are any changes in your diagnosis or your household's cancer disease diagnosis. And then please take the time to sign our petition. We have a petition here tonight, and I ask that you sign it. We will be sending them to the agency and letting them know. And we will continue to let them know. And when we have a new one on our website, we'll send that out in an email and let you know. Something else that's really important we have here on the agenda is for you to call your representatives. And if you don't know who to call or what to say, we've got that too. So we put a sample script here on the bottom of the agenda. You obviously don't have to follow it, but if you want to use your voice and make the call, but you just don't know what to say, you can take some of that, all of that, or none of it, but call them and let them know that you care and that you want the waste pits out of the river. On the back of your agenda are the 3 U.S. representatives that preside over these areas. So that, and we have the different towns that they represent. So if you just very quickly wanted to see, you know, if you're in Crenshaw's district, you can probably find that there along with their number. So we have their numbers there. And then down below that, we have a step-by-step, 5-step guide for you to find out who all of your representatives are if you don't know. So I recommend you call the congressman and the congresswoman for the EPA. But your state reps, all of your reps matter, but your state reps, I recommend you call regarding the health study. You know, they're the ones really that the health department also needs to be hearing from. All right, now questions, concerns. I want to hear from y'all in addition to just answering questions. Yes.
Just recently went to see a doctor, a pulmonary doctor, about a spot they found on my lung. And it turns out that right now he doesn't can't tell that it's really cancerous or not. But his name is Dr. Dwayne, and he is actually in Methodist Hospital over here, and he is conducting a survey and doing some research on this area because of the waste pits. So somebody you'll definitely want to get in touch with.
Yeah.
Spell the name.
It's really a crazy name. It's Ouenini.
Okay.
Did you get that, Catherine? Thank you.
Okay.
Awesome.
Yes, and so anyway, he's very interested in what what we're doing here, and wants to come out and visit with you and talk to you guys about what he's doing. And I think it's really important. And he had great information for me, and everything as far as my help, and I think it would also be good for everyone else to hear from him. So.
Wonderful. Thank you so much for telling us that. I have 2 thoughts. One, I just want to add that childhood skin cancer was found abnormally high in one of the studies. And what? I mean, our kids, it's just crazy. So the other thing that I'll add to that, perfect segue, is if you could please introduce yourself, say your name, so that the reporters that are in the room or my team, if there's follow-up, can make sure we note who you are so we can get back to you.
I'm David Taylor, and I'm with the Star Courier newspaper. So,
Thanks, David. Yes, Carolyn.
Hi, I'm Carolyn Stone, Channelview resident and Channelview Health and Improvement Coalition. I just wanted to share with y'all that my neighbor she moved there in 14 years, moved away in 2014 because she suffered from migraine headaches and other immune issues. So she left Channelview to go to a healthier environment. This summer, she was diagnosed with thyroid cancer. When they did the analysis on her removed tumor, it was a cancer that is related to being in this environment. She lives on a mountain in Missouri. So definitely far away from this now. But they said it's been hiding in her body, and for some reason it just became activated. So just a word of advice, we can move away from here, but it goes with us.
Absolutely. Yeah, thank you, Carolyn.
Yeah, I'm talking to you.
Absolutely.
Hello, my name is Omer. I work for the Coalition for Environment, Equity, and Resilience. This is my first time being involved with this, but I know that we have some information on how it's affecting the cancer rates. Do we know how this affects reproductive health?
Sure, great question. So, dioxin in and of itself is known to cause reproductive harm. There are very well known adverse outcomes from that type of chemical. As for this area, we know that Highlands specifically has one of the highest zip codes in Harris County for maternal mortality and comorbidities. What that means is that 30% of births from zip code 77562 have at least one adverse outcome. So another thing also that we know about it, not reproductive essentially, well kind of, but it affects children in a great way in terms of their learning abilities as well. Yes, sir.
What's Waste Management's proposed method of disposal?
Great question. What's your name, sir?
Doug Finn.
Doug? So he asked do we know what the proposed method of disposal is? So it will be going to a permitted facility, a landfill essentially.
Correct.
Well, they're not saying for the northern site, but the waste from the southern site went to the Seabreeze landfill in, I think, Angleton, and then I think the Republic landfill in Beaumont.
There used to be one in Anahuac. I don't know if it's still there.
Oh, okay. One in Anahuac, yeah. I'm not sure if they've looked at that one or not. I would think that they might go with the same facilities, but they're not saying at this point.
What about incineration?
So the EPA has firmly been against incinerating because it doesn't 100% break down the dioxin molecule. It gets it like over 90%. It breaks it down pretty much, but not entirely. So you would essentially, with this, especially with this volume, you would be creating another environmental disaster.
That's what they did at Sykes.
At Sykes. Will you give him the mic? Sorry. Are you saying at the Sykes disposal site?
Yeah, Sykes on the other side of 90 was incinerated, and
Sykes on the other side of 90 was incinerated, and it's still contaminated. Big time. So
See, and that's one of the 5 Superfund sites in that cancer cluster area. Now remind me, Sykes is not on the river, right?
No,
Right.
it's about half a mile off.
Okay,
When it floods, it is.
got it. Heard, yep. So, you hear about different changes, that go on at the federal level with each president, each EPA administration change. And in the last administration, they launched a study on specific Superfund sites and their threat from climate change. So I inquired recently with EPA headquarters because the Highlands acid pits was their example site that they were following for that. And I asked, hey, is this being cut because of climate change? And essentially, no. It's still being done, they're just not saying climate change. So they are still following extreme weather events and their effects on Superfund sites. So it'll be interesting to see if they loop in any of the other ones in the area. Yeah. Lisa.
For those who don't know me, I'm Lisa Gossett. I'm a board member of Texas Health and Environment Alliance. So I wanted, and I've been involved in this for probably about 12, 13 years now. I wanted to answer a couple of questions with respect to reproductive health. If you'll note, one of the cancers that was noted at high levels was cervical cancer. So certainly that ties in with reproductive issues. Dioxin is known for having an impact on your immune system, and cervical cancer very much ties in with immune responses. So that's a factor there that might be considered. Another tying in with incineration, I've been associated with multiple sites. Incineration would be appropriate with something that's a pretty much straight hydrocarbon, where it's just hydrogen and carbon, and you are burning it into straight carbon dioxide and water. For something like dioxin, where it's in parts per trillion in soil, that's really not a good option. The Sykes Limited site, or the French Limited and the Sykes sites are fairly close together. My understanding is that some of the waste from there may have been incinerated, but a lot of it was left in place. So that was not intended to be a complete removal remedy. And my understanding is there are still concerns with respect to both the French Limited and sites and the impacts they may be having on their communities. They have arguably been remediated. I use the term arguably. We're really focusing on the Jacinto River site in looking at its large scope, its proximity to people, and the fact that we are in a point in the Superfund process where we can make a difference on it. And so those, I think, are some of the factors to be aware of as a community. And yes, your input does matter. The responsible parties, without going into a lot of detail, really advocated for keeping the cap as the permanent remedy. And it was a lot of advocacy, getting consensus among our bipartisan congressional members throughout Harris County that I think made a big difference in getting the decision that no, we didn't want to leave it in the river where it's going to be a risk and wash downstream. So anyway, thank you.
Yeah, and I think, it's telling, right, that community members, I've talked to multiple community members tonight with concern about the sites over around 90, the Sykes and the French Limited. And oftentimes what we find is that these sites that say remediated, like the southern site, there's stuff still there a lot of times, right? So we definitely want to be looped in and in tune with what's going on. Yes, ma'am.
Hi, I'm April.
April?
I'm April Irwin. And is there a time frame on this? Did they give you a time frame that they were going to answer the question? Because in the Crosby area, the Barrett Station area, and in Highlands, every other week there's a funeral. And it says leukemia, pneumonia, lungs, and bronchitis, and cervical. These, and they're white, black, Hispanic, Asian. Everybody's dying out of cancer, and they can't breathe, and it's young and old. Some of us have health issues. Is there a time frame? Because it looks like, did they give us a time frame? Look like we've been, they haven't answered our questions. And people are dying out every day. And then San Jacinto, I went last week with my dad because he has cancer. And it's just people all over in our area that are being treated for cancer. So that's what I wanted to know, where there's a time frame.
Yes, so I want to recognize, that it is a fact that the communities here are disproportionately impacted with disease. Fact, without a shadow of a doubt. And in terms of a time frame for this cleanup process, so one, they should have already had a plan. They should have had a plan. They're lacking a sense of urgency for the human life now, today, and in the future that's being impacted and has been impacted and that's at risk. As long as that pit is in the river, the source of dioxin is there. And so the EPA outlined the cleanup to take 2 years for that northern pit. But the responsible parties want it to take 7. For the first time in recent design packages, we saw the responsible parties come back and say, EPA, and I'm paraphrasing here, EPA, if you require us to do it in less than 7, we'll do it. So, if y'all have any clown costumes, they're not taking us seriously, right? So Lois Gibbs, Love Canal, the mother of Superfund, she would probably show up at the next EPA meeting in a clown costume. They're not taking her serious, right? And that's how I feel. We talked about, we showed the stock changes in waste management since 2018. But many of you have battled for your life since then, and not just because of COVID. Many of you and us have buried loved ones, have lost people. They really need to be treating this issue with the sense of urgency that it deserves.
So I am Pamela Bonta. I've been doing this for over 15 years. And I would just like to say, I used to live on the main road, going out of Highlands. And I would see the hearse come by my house almost every day, going to that graveyard. It is packed, that graveyard. I moved here in the early 2000s, and there wasn't a whole lot of grave sites there. Now you can't even, it's packed. And it's almost a daily hearse I would see go by my house. So I started going door to door. And I started talking to all my neighbors and asking them, because we lived out in the country and you're not close enough that, unless you go knock their door and say, hi, I'm your neighbor that lives, half an acre away. So I started going door to door, and almost every house, I did it for over 2 years, almost probably 4 or 5 days a week. I would go out and knock my neighbors' doors. And almost every door I hit, either they knew someone with cancer, they had cancer, their animals had cancer, their kids had cancer, and I thought, am I in the twilight zone? Is this seriously real? And who's gonna listen to me? I used to put signs on my fence. We're dying from cancer, heavy metals and chemicals. People would rip the signs off and accuse me of being crazy. But I was doing the footwork on the ground, and I can tell you, there is a lot of illness in this town, and it's overlooked, and it's downplayed. And that's not okay. I've been fighting for my husband's life for 20 years now. He was in his early 40s. We're lucky he's made it this far. He has multiple myeloma. But within a couple blocks, I found 12 people with multiple myeloma. What the heck? It's 1 in 100,000 in a town that should have myeloma. But I'm finding 30-year-olds with myeloma. They're no longer here. So this is not okay. This is of urgency. I beg all of you, take this to 5 or 10 people. Let them know what you've heard. And I hope they're as outraged as we are. Because this is not a joke, this is real. And this is real money, real people's homes, your life investment. That's what's on the line, your life. So that's just what I wanted to tell y'all.
Yeah, thank you. And that reminded me, before we pass it over, actually, would you bring it over here next since, sorry, Carolyn, she hasn't spoke yet. That reminded me about endometriosis. And it's just a really terrible disease. I've had it for a very long time. I know a lot of women who have had it. And there's not a registry for it. And so, like endo, like lupus, autoimmune diseases, there's not a registry that tracks it. But we care about all of that. So please don't think you can't fill out our health survey because you don't have a cancer diagnosis at this time. We still want to follow all of the disease types. Yes, ma'am.
My name is Carla Martin, and I'm a third generation of the Cloverleaf Channelview area. And every male member of my family has died of cancer.
Wow.
What's with this data, with these cancer studies, is these people retire and move off if they're lucky enough to get to that age. But the data, if they had the true data of the cancer rates in all of our communities, it would make major news. Almost everybody in my high school has died of cancer. And that was a class of 300. I don't know what to, they could go door to door. But the people that are living there now has no idea that maybe 3 people in that home has died of cancer.
Right.
So the data is very distorted, and it's not the actual figures. Now I'm concerned about this waste. Is the solution going to be to clean it up here and dump it on someone else in the country?
Right. Wholeheartedly agree with what you said about people moving away, and that is part of the shortcomings of these types of studies, or like a full-blown epidemiological study, right? You miss a lot. As for the waste and where it goes, we were not successful at getting the EPA to classify the waste at the southern site as hazardous waste. Which is a whole crazy rabbit hole. So we're still pushing for the northern site, for the waste to be classified as hazardous. I said in the beginning of my presentation, what prompts a Superfund site to get listed as a national priority is the presence of hazardous material. One time at an EPA meeting, we handed out magic wands at the front door. Because we were like, do you have magic wands, EPA? How can the process for this be started calling it hazardous, and now you're going to take it out of the ground and call it non-hazardous, and you're going to go put it in a landfill that's a non-hazardous landfill? How does that make sense? So, where it is going, it is a permitted facility that accepts non-hazardous Class 1 waste. But to some people, even in the EPA, it is mind-boggling to them that the EPA has allowed this to be classified as non-hazardous. And so once it's removed from that site and disposed of, it goes into a different regulatory process. Or once it's removed and hauled, it goes into a different regulatory process. And that's where we've been battling against that hazardous or non-hazardous. Carolyn.
Okay. Talking about all the people who's died has made me think, can we pull the data of all the people in our area that have died of cancer and get those numbers since the ones that have died, just since this process has began, since it's been declared till now? How many people have died needlessly? Also, break it down. How many were adults? How many were kids? I know people have moved away and are still coming down with and dying, but the people who are here and are recorded that have died of cancer, what are those numbers? So that, it just, we're talking about how many people who's living with the cancer and who's been diagnosed. What about the ones who are no longer with us? What are those numbers?
Yeah, I'm not sure about that. Catherine, though, will you make sure to note that? We'll definitely look into what that looks like.
And then my other was a suggestion. The letters that you sent out, would it, or do you feel like it might make a more of an impact if all the letters went out in a colored envelope or a number with the Thea logo or a colored envelope that you could see it, you can pick them out of the pile of letters? Because 300 letters is a lot of letters. 300 white letters, you don't notice.
Yeah, that's a great point. Yeah, good suggestion. I was going to say Kristen's not here. But team, please make sure, yeah, that's a great idea. Yeah, I could just visualize it, right? Scattered in the mailroom. Yeah, great suggestion. Is it?
Yeah.
What's there?
Oh. Sarah. It's just kind of a snide remark.
Oh. I was like, what are you doing over there?
Well, since EPA people don't really think it's all that dangerous of chemicals, when they remove it from the pits, just take a truckload and dump it in their front yards, each one, and see what they think.
Yeah, they'd probably feel differently. Yeah.
So this first comment is going to come from my environmental law background. I am an environmental attorney. And as strange as it sounds, you have very nitpicky, legalistic definitions. And so if something's a hazardous substance, it can trigger being a Superfund site if it ends up presenting enough risk. When you look at disposal, there is a very narrow definition of hazardous waste. They also have a classification that's industrial waste that doesn't quite fit in there. They're just how have you defined things on paper rather than always looking at what is the actual risk from the material you're disposing of. But when you're looking at waste management and international paper, who will send 12 attorneys into a court hearing because a Texas state interpretation gave them unlimited defense costs on these issues. That's a different issue. You've got EPA, as well as the community, has to be careful how those definitions are followed, or they're going to get sued by Waste Management. So that's something we really haven't discussed much, but it is certainly a consideration. I have found most of the EPA personnel to not be bad people. They are overextended and constrained by the laws and the system we have to work with, which has been very anti-regulating pollution, unfortunately, the last few years. Also looking at a comment, some of you have heard this from me before, is the only really good solution would have been not to put this here to start with. We have to work from the fact that it is where it is. And considering that, there is no perfect alternative for dealing with this. There is none. So if you're looking for the perfect alternative, then you end up doing nothing. And I'm looking at a highly toxic waste sitting in the middle of a highly active and erosive, frequently flooding, hurricane-prone river, where arguably 50 to 60% of it has already, before they rediscovered it, gone downstream into Galveston Bay, versus putting it into a permitted landfill that's not in the floodplain, that has a liner, that's going to be consistently monitored. Is that an ideal solution? No. Is it better than leaving it in the middle of the river where it's going to continue to expose seafood and continue, if not maintained, for hundreds of years, move downstream? And so that's how I look at that situation. Again, is it perfect? No. Do we want to subject another community to what we're dealing with? No. And with the safeguards in place, hopefully that shouldn't occur. And again, no ideal solution other than to prevention. And that's a broader issue to look at as we move forward, is not to create problems that other people will have to deal with in 10, 20, 40, 50 years. So anyway, I was on a soapbox. Sorry.
Yes, ma'am. Amy, if you'll run it back over here.
Also, Jackie, I was wondering if these hospitals, without violating HIPAA, could somehow keep data on cancer diagnosis with zip codes.
Yes, so yes, it is reported to the Texas Cancer Registry. From the zip code, the diagnosis is made. And fun fact, the state of Texas, the data that we're asking for, that they've told us they have for this area, they are sharing, but only to institutions, not to the public. They haven't.
It's too bad, because I think if it was with the public, people would be, this room would be standing room only.
Why don't they have it?
Yeah, what are they hiding? I mean, you know, there's no reason to not share that information. Maybe that would prevent a young family from coming from Ohio to settle in this community. I mean, it's really unfair. They really need to share that information and let people know you are moving into a very harmful site that could affect your family for generations.
I agree. Did any of you, back when we were hosting our cancer cluster meetings, gosh, probably 2 months ago, did any of y'all receive a postcard about it? No? Okay. There's thousands of residential addresses in this area. You did?
I received one, but I questioned them about who all received them. And what I was told was the only people who received one was the ones that the EPA had addresses. So if we
Wait,
had
what?
attended-
That's not what I'm talking about. What did you receive?
I received a notice of the EPA, the cancer cluster meeting.
Oh.
The EPA, the one the EPA was at, they didn't.
Okay, so the EPA's public meeting for the waste bin, it's not cancer cluster.
Right, yes.
Okay.
I'm sorry, not cancer.
Okay.
I'm sorry.
No, so we are trying out email or sending out postcards to inform people about sites in their area. And I think we did about 300 for the cancer cluster meeting, but we just basically, picked locations here and there around the river. So I was just curious if any of you received them.
You can also follow us on starcouriernews.com. We had about 11,000 views on that last story in Crosby. And there's actually a story of a family who did move here from out of state to Crosby and bought a beautiful home on the lake. And then they found out about the cancer cluster, and so they're a little unhappy and considering moving, if they can.
Yeah. Yeah. No, it's terrible. We'll take, if there's one more question or concern, I'll go ahead and take it, and then we'll break. Yes.
Good afternoon. My name is Hunter Marlowe. I'm an oil worker from Conroe, and I live in New Caney. Been a resident of the area for my entire life, so I do care deeply about this issue. My question is, what are the community-oriented solutions that we can apply to this situation? And then, what is your draft proposal in order to resolve this problem for the Southeast Texas community?
Are you related to Dave?
Dave?
Yeah.
Dave who?
Marlowe?
No.
No, okay.
Don't know.
Okay, so first let me go to this slide here. So we are in agreement with the EPA's remedy, or their design, or how they have ordered the cleanup of the site to go. Fully isolating the site, going beyond the cap, so that they would be drilling into the river bottom beyond the northern pit, and then removing the water, removing the waste, and hauling it off. So we definitely are in agreement with that process. And then your second question about, are you talking about beyond this site?
Beyond relying on local government officials, what are the community-oriented solutions?
Sure. Great question. So I'm kind of an every man for themselves, every household for themselves. I feel very strongly about information. I believe people who are fishing should have information about the contamination in the seafood, safer alternatives, local food pantries. And then also I firmly believe everyone should be filtering their own water that comes into their home. And whether they're on a well or a public source, our water laws are very flawed and not necessarily to protect us. And then there are some interesting things you could look into about mushrooms and remediating land. So if one has land, then there are certain types of activities that they could do on that land to help remediate or clean or purify that could be low cost. Another thing also, detoxing, regularly eating certain things that can help detox our bodies. Yeah, so those are things that I think as individuals, we can do. But, ultimately the source, that's really the big push. Doing things in our lives and on our properties as individuals. But as long as we're doing that and we live amongst contamination, I feel like we could never fully succeed. Yes, I'm sorry. Okay, two more. Last one. Yes, ma'am.
Hi, my name is Maria Solis, and I'm sorry I'm not 100% English speaker, but I'm going to try my best.
Thank you.
I live right here close to the river, about less than a mile. But I wanted to know, we know that we have an existing situation, existing problem. But how we can start doing something, how we can protect ourselves about all this. Is there any kind like get a bottle of water, so any water purification system, or what do we need to do, because now for now we know we in the situation already.
Right.
So I'm concerned about this because I had a problems in my skin in the past, and now my grandson is dying. He's got a diagnostic by pulmonary disease or something like that, and it's not fair. It's not fair. We are human beings, and we need to do something. And now, for now, what do you recommend us to do?
I absolutely agree with you.
I'm sorry. Thank you.
No, thank you. I believe that we should filter the water that comes in our homes. There are a couple of companies that can send you can purchase a filter, and they will like literally send it to your home. I've been doing a lot of research on different carbon filters for homes, and so carbon filtration can be very effective. And so I think that that's important. I wouldn't let my child recreate in or around the river. I wouldn't let him. I know recreation on the river is very popular. I grew up doing it. I've had my fair share of health problems. I wouldn't recommend it. You know, I would definitely take caution. I wouldn't, you know, if it were my kid, I wouldn't let him recreate in there. It's just like driving without our seatbelts and you know, doing things that we know can cause problems and be unsafe. And then certainly, if you do fish, release it. Definitely not consuming any of the local seafood. It's all under advisory. Crab and all of the fish species are under advisory. Yes. And we have information as well about that at the table. If you're on a well, we have information about private well management also. Okay, all right. Okay, Carolyn, and then we're gonna let y'all go.
I just want to say that in response to your question, community-based, share the information.
Thank you.
That this information, Jackie has a lot of it. Other organizations have a lot of information. But it does absolutely no good to the community if it's not shared. So that's primary. And if you see someone fishing or playing in the water, tell them. As long as Jackie's been having these meetings, and as long as people have lived in this community, you still talk about the waste pits and they're like, what waste pits, where are they? So basically, hey, make people aware that this is a super fun site here. You don't eat the fish, you don't do this, you filter your water, you know, do what you can. But it's the sharing of the information, because we can sit in this meeting every day, of the year. And if the information doesn't go out of this and it's not shared, there's no community-based prevention going on.
Yeah. Yeah, thank you very much.
Can I hit you with another one? I don't need a microphone for this one. So the contaminants are shown to be within this kind of 250 square kilometer area, or mile area, wherever.
Cancer. That's the cancer area.
Yeah.
That's different from the...
Okay, so how far upstream are we talking that the contaminants go? Because this is kind of like the Houston Bay area.
Sure.
Do we see those contaminants further upstream, kind of pushing back?
So they haven't tested the sediment all the way up to Lake Houston Dam for these contaminants, but the seafood up to the dam and in all area waterways have fish and finfish that have been found to have these contaminants. And we definitely have a map of that at our sign-in table. And I'd be happy to talk further with you as well about that. All right, thank you all very much for being here tonight, and